The different forms of trauma. Presented by the Ward and Wellness Services. In association with CJ Ward Creations. Young children who experience trauma are at particular risk because their rapidly developing brains are very vulnerable. Early childhood trauma has been associated with reduced size of the brain cortex. This area is responsible for many complex functions including memory, attention, perceptual awareness, thinking, language, and consciousness. These changes may affect IQ and the ability to regulate emotions, and the child may become more fearful and may not feel as safe or as protected. For survival and protection, both physical and emotional, young children rely solely on their parents/caregivers. When a parent or caregiver is similarly impacted by trauma, the relationship between that person and the child may be severely harmed. Children may face overwhelming stress if they do not have the assistance of a trusted parent or caregiver to help them regulate their strong emotions. They may also have limited ability to explain what they feel or need. They frequently develop symptoms that parents and caregivers are unaware of. And they may exhibit unusual behaviors that adults are unsure how to respond to. Symptoms and behavioral patterns. Young children, like older children, have both behavioral and physiological symptoms as a result of trauma. Young children, unlike older children, are unable to convey their feelings of fear, overwhelm, or helplessness through language. Young children with traumatic stress symptoms have a hard time controlling their emotions and behaviors. They may be clinging and terrified of unfamiliar surroundings. Quickly frightened, difficult to console, violent and impulsive, and/or aggressive and impulsive. They may also have trouble sleeping, lose previously acquired developmental skills, and display functional and behavioral regression. Children aged 0 to 2 who have experienced trauma may have poor linguistic abilities, have memory problems, scream or scream excessively, have a poor appetite, low weight, or stomach issues. Children aged 3 to 6 who have been exposed to trauma may experience a struggle to focus or learn in school, develop learning disabilities, show poor skill development, act out in social situations, imitate the abusive/traumatic event, be verbally abusive, be unable to trust others or make friends, believe they are to blame for the traumatic event, lack self-confidence. Enhancing resilience with protective factors. Traumatic experiences have serious consequences for young children, but not all children are affected in the same way or to the same extent. Children and families have abilities, psychological resources, and resilience that can shield them from long-term harm, often even in the face of considerable stress. The consistent presence of a positive, caring, and protective parent or caregiver, according to research on child resilience, is an important protective element that can help insulate children from traumatic events. They can be a continuous resource for their children, encouraging them to talk about their experiences and assuring them that the adults in their lives are doing everything they can to keep them safe. Screening and assessment. Screening and evaluation in a variety of systems. Because of the developmental risks associated with traumatic experiences in young children, it is critical that susceptible children are recognized as soon as possible following the trauma. Many community resources, such as health systems, early intervention programs, child welfare agencies, Head Start, child care programs, and early education systems, are crucial in identifying children and connecting them with assistance. Some of these systems are now incorporating inquiries regarding specific traumas into their intake and/or assessment protocols to address the possibility of traumatic events. Intake protocols for Head Start and early intervention, for example, contain questions about family domestic abuse. Other methods could include specific questions concerning accidents, family members who have died, and/or significant medical histories. Most young children are visited by pediatric healthcare practitioners on a frequent basis, allowing for multiple opportunities to discover early childhood trauma. As a result, medical professionals can help reduce the hazards and maximize the protective factors linked with young children's trauma exposure. They can provide accident prevention information and ask questions about stressful and traumatic experiences during conversations with families. Assessments for young children have a specific focus. When it comes to assessing trauma in young children, it's important to look at the presenting issue in the context of the child's overall development. Interviews with the child's parents and major caregivers, observation of the parent/caregiver-child relationship, and standardized assessment methods can all be used to acquire this information. The clinical evaluation should involve a consideration of the specifics of the traumatic event, such as the child's and parents/caregivers' reactions, changes in the child's behavior, resources in the environment to help the child and family stay stable, the quality of the child's primary attachment relationships, parent/caregiver's ability to support the child's healthy socio-emotional, psychological, and cognitive development. When evaluating a young child, it's also important to look for developmental delays, example, gross/fine motor, speech/language, sensory processing, which could indicate that the child would benefit from a different professional's evaluation and/or services, example, occupational therapist, speech/language therapist, physical therapist. Consultation and collaboration with these professionals is frequently beneficial. Interventions. As the presence and impact of trauma on young children has become more widely recognized, more age-appropriate therapy options have been developed and evaluated for this demographic. Many of the essential components of these therapies are similar. They are often connection-based, focusing on mending and supporting the child-parent relationship. Early childhood trauma. The term early childhood trauma refers to traumatic events that occur in children ages 0 to 6. Many people believe that young age protects children from the effects of traumatic experiences because infants and young children's reactions differ from those of older children, and because they may not be able to voice their feelings to scary or dangerous occurrences. Young children can be affected by events that endanger their safety or the safety of their parents/caregivers. According to a growing body of research, and their symptoms have been well recorded. These traumas can be the result of intentional violence, such as child physical or sexual abuse, or domestic violence, or the result of natural disaster, accidents, or war. Young children also may experience traumatic stress in response to painful medical procedures, or the sudden loss of a parent/caregiver. Effects. The characteristics of early childhood trauma. In young children, traumatic events have a significant sensory influence. Fearful visual cues, loud noises, forceful motions, and other sensations connected with an unpredictable, scary event may destroy their sense of safety. Nightmares, new phobias, and acts or play that repeat the event are common occurrences. Due to a lack of knowledge of the cause and effect link, young infants believe that their ideas, wishes, and fears have the power to manifest and make things happen. Young children are especially sensitive to the impacts of trauma, because they are unable to foresee danger or know how to keep themselves safe. When a 2-year-old experiences a terrible occurrence, such as his mother getting beaten, he may understand it very differently from a 5-year-old or an 11-year-old. Children may blame themselves or their parents for failing to prevent or modify the outcome of a distressing occurrence. These erroneous perceptions of reality exacerbate the harmful impacts of trauma on children's development.